Hello and welcome. My name is Christian Beard, and today I have the pleasure of reflecting on my experiences creating and sharing the development of a project that I am excited about and look forward to seeing its implementation in the future. I will also reflect on my professional growth throughout the RN-to-BSN program. Over the next several minutes, I will discuss key aspects of my project, the impact on patient and family satisfaction, the integration of evidence-based practice, and the significance of health policy in shaping my work. To start, my practicum was an incredible opportunity to immerse myself in the clinical setting, specifically focusing on pediatric patients recovering from heart surgery. My Capstone project aimed to address the mental health challenges faced by these patients and their families during the perioperative period. I quickly found out that this is a well-researched topic with most studies conducted recently. Once I read the statistics on how frequent mental health challenges were observed in this patient population, I knew that this topic was highly relevant and wanted to spend my time developing a project that I am passionate about. Literature notes that between 30 to 50% of pediatric cardiovascular patients are affected by mental health challenges. Upon reading this, I knew that my observations were correct in noting that this was an issue. As a pediatric cardiovascular ICU nurse, I have gained an extensive amount of knowledge on the anatomy and physiology of the heart and its relation to the overall function in the body. However, once patients are in a less critical state and on the road to recovery, I missed the opportunity to closely observe mental health status and educational growth as the patient is preparing to eventually go home from the intermediate care unit. I witnessed patients and families go through life-changing hospitalizations that oftentimes change the trajectory of their lives. In this environment, it is extremely rewarding to work among an entire healthcare team that is dedicated to delivering care that gives children a fighting chance to live fulfilling lives. However, heart surgery alongside long hospitalizations and the side effects of continuous procedures has a critical impact on the mental health of these patients. During my time on this unit, I have noticed that we dedicate most of our focus on the physical aspects of recovery, while many of these patients are left suffering with mental illnesses such as depression. Although many of the surgeries and procedures are life-saving, we take for granted the disruption that illness and hospitalization causes in the lives of these patients and their families. This is especially true for teenage patients who look forward to the experience of going to high school, participating in sports, going to prom, and many other experiences that are typical for the average child. This vulnerable time extends to the family who may not be from the local area and sometimes travel from distant cities, states, or even countries to receive care. The stress of battling emotional turmoil regarding unpredictable outcomes of surgery for a severely critical child, financial strain, and the road to recovery can be overwhelming. For these reasons, I chose to focus on mental health among a population of patients where mental health is not typically prioritized. The Capstone project gave me the opportunity to explore a different aspect of care and gave me a greater appreciation for holistic care. I got to know patients and families on a more personal level, which allowed me to discuss their mental, spiritual, and sometimes basic needs. I have found that patients of highly educated families often fare better in these situations as the family advocates for assessment and treatment of mental health issues. When they identify behavior or mental states that are abnormal and seek resolution, it is then prioritized. However, there are many families that cannot identify mental health issues, and again, the issue is disregarded. While there are several approaches to remedy the lack of mental health prioritization, I chose to focus on educating patients and families on ways that could contribute to improving patient outcomes regarding mental health. The contribution of the educational PowerPoint to patient and family satisfaction has been significant. Feedback collected from families indicated a marked increase in their confidence to discuss mental health issues and seek help when needed. Parents report feeling more empowered after receiving educational materials about common emotional responses and coping strategies. The intervention structure improved families' understanding of the psychological impacts of surgery, leading to an enhanced quality of life for both patients and their caregivers. According to a study conducted by Davis and Bass 2025, educating families by providing information in an engaging way promotes improved communication between families and the healthcare team and allows them to be actively involved in decisions regarding treatment. Patient feedback on the PowerPoint was overwhelmingly positive. Families expressed appreciation for the proactive mental health screenings and support provided. One parent commented, "I wish we could have had something like this in the beginning. So much information is thrown at you in the beginning, but you can't remember everything when all you really hear is that your child needs heart surgery." I was an emotional wreck. I feel like if I had known of some of the resources you talked about, I would have certainly used them. Another parent noted, "Having resources and information readily available made it easier for us to discuss our child's feelings. We felt supported, which eased our anxiety." This kind of feedback highlights the intervention's effectiveness in enhancing the patient and family experiences. Throughout the planning and implementation of my Capstone project, I utilized evidence and peer-reviewed literature to guide my approach. Research by Ma et al. 2025 and Grunwald et al. 2025, among others, highlighted the importance of addressing mental health in pediatric cardiac recovery, which provided a solid foundation for the educational PowerPoint. Aligning my interventions with current evidence-based practices ensured that I was implementing strategies known to be effective in enhancing mental health outcomes. The principles of evidence-based practice informed every aspect of my project, from identifying specific mental health screening tools to creating educational resources for families. Grounding my intervention in solid research allowed me to propose a solution that is effective and measurable in terms of the impact on patient care. In terms of healthcare technology, I was successful in integrating the patient's electronic health record, or EHR, into collaborative care practice. I was able to consult child life specialists for the patient through this feature, which provided additional support to the patient in addressing critical issues like treatment adherence. The child life specialist even helped with leisure activities such as gaming to bring enjoyable experiences to the patient's hospitalization. Unfortunately, I did not get to witness the use of technology such as telehealth services, as this is an intervention that I recommended for after discharge and follow-up care. However, families did mention that they were open to using telehealth as it appears to be convenient. Looking ahead, there are further opportunities to improve technology use by exploring innovative ways to engage families through mobile health applications or tailored online platforms. Health policies significantly influenced the planning and implementation of my project, particularly regarding the integration of mental health care into pediatric CVICU protocols. Policies such as the Texas Mental Health Code that mandate mental health screenings paved the way for developing my intervention promoting ethical care that prioritizes holistic health for pediatric patients. Throughout my work, I observed how baccalaureate-prepared nurses play a crucial role in policy implementation by advocating for best practices and contributing to discussions about how policies can enhance patient safety and care quality. Evaluating my capstone project outcomes against my initial prediction shows a promising alignment. While I anticipated challenges, the success of my educational intervention exceeded my expectations regarding family engagement and positive impact on patient mental health. Going into the project initially, I wasn't sure how receptive patients and families would be to the information I was providing. I found that the families were pleased with having their needs assessed and being provided with additional support and resources. I believe that the educational basis of the project has the potential to be adopted into practice within the pediatric CVICU setting. Its design is adaptable and could be generalized to various surgical populations, emphasizing the importance of mental health support across different contexts. My experiences throughout the RN-to-BSN program and the Capstone project have honestly changed my mindset in many ways. I have learned to value leadership in a different way. Initially, I saw leadership as the problem solver or rule enforcer. However, I now see that leadership plays an important role in influencing the culture of an organization, and they influence change to continually promote an environment that is sensitive to patient safety and evidence based practice. They are crucial to the innovation of practices that are evidence based and have a knowledgeable perspective as to why this is important to care delivery. Personally and professionally, I have experienced a tremendous amount of growth. I have honed my skills in leadership, collaboration, and communication, which are critical to effectively advocating for patients and families. The Capstone Project increased my understanding of the interplay between mental health and physical recovery and deepened my commitment to providing holistic care. Over the entirety of the program, I have been refreshed in my commitment to ethical care and ensuring that my interventions respect patient autonomy and prioritize their needs as the basis of a co-piloted relationship. I take particular pride in my efforts to engage with diverse families and integrate their feedback into this program, recognizing that every family's journey is unique. I now have knowledge and understanding that pushes me to seek resolutions to issues through research. I can truly say that this program has lit a fire within me to look to published and comparative data to improve my knowledge as a registered nurse and share that knowledge with others. My practicum experience in the development of an educational intervention have been transformative. I am confident that the comprehensive approach to mental health support will significantly enhance the recovery experiences of pediatric patients and their families. Thank you for allowing me to share my journey with you today. I look forward to applying these insights and strategies in my nursing practice moving forward.